I've always been driven towards art and I've always wanted to help people. So when I found out you could combine both of those things together, I was like, this is exactly what I want to do for the rest of my life.
So we're not learning how to create art, we're learning the therapeutic properties of these art processes.
My favorite part of the program is seeing the power of art therapy every day.
Art therapy isn't about making pretty art. It's about using the creative process for healing and expression.
So think about it like this. Doctors are able to prescribe medicine, right? So for our therapists, we prescribe processes and materials to our clients based on their needs.
Are we artists? Yes. Are we like psychologists? Yes, we're both. So we can think about therapy actually as a creativity.
They're trained to work with the client on common or shared goals, for instance, reducing anxiety or depression or getting more enjoyment out of life. The Graduate Art Therapy and Counseling program is a 2-year program, has technically 5 semesters.
So their coursework, their 3 internships, and a capstone project in the course of 2 years.
When I first started looking at programs, I looked at what were the best in the country, and EVMS is rated one of the top in the country. And I think that it shows.
Knowing that we have access to so many internship sites when we come in for the interview and all the opportunities to work with different clientele is definitely appealing.
The program's great. It's really rigorous. It's a lot of work, but I guess you expect that in a graduate program, especially at a medical school.
The curriculum is really thought out, and so that we are licensure ready when we're finished. And that was a big thing for me because I didn't want to be in a place where when I'm done, I don't know what to do next.
There are about 30 programs in the country, and we've often been deemed as one of the most highly clinical art therapy programs, and also probably one of the most comprehensive programs.
Also, a thing that's unique about our program is the opportunity for students to work with standardized patients in the simulation center. No other program in the country has standardized patients for art therapy. We have a 2,000 square foot fully stocked studio. It has every art media imaginable that an art therapist would typically use.
The studio is a large space. We have 24-hour access. We have unlimited materials, and you can really just make whatever you need to make to learn how a client or a patient would work with the same materials. Every time I work with a patient and I have the tiniest bit of success, it feels like the right thing. So that's how I know that this is the right thing for me.
I know what art has done for me personally, a way to express myself, my feelings, and just kind of dive into who I am and how I present myself. So I know what that does for me, and so I want to be able to share that with other people.